The story of volunteers on crisis lines starts in the 1960s with some of the first programs of its kind here in the Bay Area. In San Francisco, we had a gay British priest who started a crisis line in the back of a tattoo parlor. A few years later, there was a reverend who wanted to bring the same kind of community support to the people of the East Bay, and he started a crisis line in a barbershop. There are stories about him picking up the phone while cutting people's hair. This was not an institutional response. It was peer support, neighbors helping neighbors. To give some context, it was only 1957 when 75% of American households had a phone. In 1958, the first phone-based suicide prevention program was created in Los Angeles, using the phone to bridge a connection gap and provide people the support they needed. This was a time when people were thinking about, how do I connect people? How do I uplift my community? And how do I make a difference? To give a sense of the political and social landscape of the time, a few miles away from that barbershop, we had Senator Robert Kennedy giving a speech at UC Berkeley about poverty, race, and inequality. A few miles in the other direction, we have the Black Panther Party forming in Oakland, and they are putting together health centers and free breakfast programs. This is a time where people are grappling with the failure of the establishment to meet community need and thinking about taking matters into their own hands. These first pioneers really understood that the antidote to some of the challenges of the time was connection. Over 60 years later, we now work in real offices, and we have entire conferences dedicated to suicide prevention and crisis support. Yet volunteers and lay counselors remain at the heart of suicide prevention and the impact of 90-day suicide and crisis lifeline. People decide to volunteer for crisis lines for lots of different reasons. It might be because they've lost a loved one to suicide. It might be because they've had a history of their own suicidal thoughts or actions. It might be because they want to gain skills or build community. One thing that people have in common when they show up to volunteer is that they see the value of connection. And that became really apparent during the COVID shutdown. I want to make sure you're picturing this accurately. Because of the public health worries and regulations around safety, most crisis line operations at this time had gone remote. So we have volunteers and staff working from their bedrooms, working from closets. We even had a staff member send the picture working from a bathroom to ensure confidentiality when everyone was home. And in this moment, I had a volunteer tell me that the silence of shelter in place made it harder to not hear the call to action. And that really resonated with me because it captured the spirit of that moment so well. During those early years of COVID, there was an increase in volunteering in general and an increase in volunteering on crisis lines as well. This was because people wanted to show up for their communities and they were looking for a sense of connection for themselves as well, and volunteering does that. In 2023, the Surgeon General released a report called The Epidemic of Loneliness and Isolation, and in it, a virtuous cycle was identified between volunteering and connection, and this really validated what we were seeing on the ground. Another factor that COVID highlighted was that people were drawn to suicide prevention because this broader social awareness. At a time of blatant community need that was leaving so many of us feeling hopeless or helpless, people wanted to feel like they were doing something. When we see people struggling, we want to feel like we're part of the solution. And volunteering on crisis lines does that because crisis lines show up for people. And that was really replicating the same sense of community connection and care that started the peer movement in the 1960s. At first glance, I think it's easy for people to assume that using volunteers on crisis lines is a financial strategy. but it's actually about increasing our power. The financial benefits of having volunteers on crisis lines has diminished significantly over the years, with costs associated with recruiting, screening, training, and supervising people to keep this work effective and going. But where volunteers are vital is that they take suicide prevention outside the crisis center. And in doing so, they increase the crisis response capabilities within their communities significantly. That could be in their homes, schools, workplaces, and any community they belong to. The long-term return on that investment is unquantifiable. An average volunteer might talk or text with about 150 to 200 callers or texters in the course of a year. Yet the ripple effects of their volunteering is exponential and goes far beyond their time on the crisis line. I had a volunteer share with me that she was able to support a friend of her daughter's who was feeling suicidal. In that moment, she was able to be present, to be a listening ear, and ultimately get this young person to ask for the help they needed. That's a big deal. Imagine the difference between staying calm and knowing exactly what to do in a situation like that and panicking. And that story is not an exception, it's the rule. In 2024, there was a survey of over 2,100 crisis text line volunteers, and in it, over 88% of them reported that they had used their skills multiple times outside of volunteering in the last 6 months. That is a lot of conversations happening off the clock. The other major factor about volunteers is the stigma reduction power they bring to suicide prevention. Stigma is the negative internal or group beliefs we might hold about what it means to be suicidal, to have lost someone to suicide, or to even ask for help. Decades of forced institutionalization and over-reliance on police have only increased people's hesitance to speak up in moments like this. That reinforces both the stigma and the sense of isolation that somebody might be feeling in their moment of need. Volunteers address that isolation head on in the moment. They are there when someone is sharing what happened that day. They're there to witness the pain. They are active, empathic, and non-judgmental listeners. And the fact that they're not mental health professionals or clinicians is actually increasing the stigma reduction power. Basically, many people would rather talk to someone from their own community about what's going on with them. But the magic continues when they're off shift. Just the fact of someone talking about volunteering reduces stigma. So if one of you know of someone who volunteers on a crisis line, that signals to you that people like you can talk about suicide. Another more practical way to think about it is if I know someone who volunteers on a crisis line, I'm more likely to just know about the resource and see it as one I can trust. That trust is key to people asking for help in a moment when they're feeling vulnerable. Knowledge plus trust equals action. In the same survey of the 2,100 crisis text line volunteers, literally 100% of them reported having talked about their volunteering in their social circles in their last 6 months. So those conversations create ambassadors in different communities and are expanding the power that we have to have what could be life-saving discussions with people that we care about. There's a pressure in our society to have things under control and to be fine. But I see on a day-to-day basis how people want to talk about their struggles and suicide. When I tell people what I do, which is run a crisis center, many people share with me about struggles in their family. Many people tell me about someone they've lost to suicide. And I'm not talking about my best friends here. I'm talking about getting in an Uber or Lyft. I'm talking about waiting in line to pick up my kid at school. I'm talking about going to the dry cleaners. A few years ago, a family I used to babysit for texted me, asking if I would be willing to talk to a friend of theirs whose spouse was feeling suicidal. It was like multiple degrees of separation. It's because having a loved one who's going through a suicidal crisis can be really scary. But knowing people who can help makes it less so. So there's this assumption that no one wants to talk about this. But I'm here to say that assumption itself is based on stigma. Considering the suicide prevention ripple effects of volunteering on crisis lines, it's important to name that not everyone has access to volunteering. Volunteering on a crisis line requires a 4-hour weekly commitment following a 90-hour training. The time and resources required alone can become a barrier to entire communities, cutting off their access to the knowledge, skills, and resources that could be life-saving. When we know that suicidal thoughts and behaviors can be a response to racism, poverty, and community violence, this is not a relationship we can afford to ignore. Additionally, in communities that are experiencing some factors like racism, poverty, and community violence, there is an instinct to not ask for help that could include law enforcement. Therefore, the community capacity to support itself is additionally important. Crisis lines alone aren't going to solve the rising suicide rates in this country. What we need is to work together to build communities that are more just, interconnected, and equitable. But research does show time and time again that crisis lines are effective. They're effective at providing emotional support, at de-escalating a crisis, and connecting people to local resources without an over-reliance on emergency services and the police. And that's worth knowing. In the 3 years since its inception, the 988 Suicide and Crisis Lifeline has received over 17.7 million contacts. That's calls, texts, and chats. This would not be possible with one crisis center. This is the power of a network of over 200 crisis centers working locally to connect people in need to people who care. The number of contacts to 988 has been going up. And that shows us that that need for connection is more present now than ever. If one of you here needs to talk to someone after the event, a trained counselor from San Francisco Suicide Prevention will pick up the call. If later tonight someone's at home in Oakland and they need support, one of my colleagues from Crisis Support Services of Alameda County will pick up that call. The same 2 crisis centers that our story started with today. The story of crisis centers, which started in barbershops and tattoo parlors, is the story of ordinary people who refused to accept the status quo and understood the power of community care and connection. That revolutionary spirit, the power of the people, is not a historical footnote. It's the 988 volunteer on the other end of the line today.